Thank you very much. I would like to thank the organizing committee for giving me the opportunity to present in this excellent Share Congress. And of course, congratulate all the speakers and the chairs of this great session with well-renowned experts on sarcoidosis. Also, many congratulations on the organizing committee for organizing an excellent Congress this year, as always. So in this presentation, we will explore how early career members actively shape clinical guidelines, lead scientific initiatives, and drive the future direction of respiratory medicine societies. My presentation will be more general about respiratory medicine. However, all these data are well fit also early career members focused on sarcoidosis. I have no conflicts of interest to declare. We will cover first some data of my own experience as early career members. Then we will explain who are the early career members, what are early career committee structures, why ECMs are important in guidelines, and how they can work in the guideline formation process. Are there fellowships and mentorship programs for early career members in scientific societies? How can early career members engage in congresses and scientific meetings? And what are the challenges and future perspectives of the early career members? So my personal journey as an early career member, I had the opportunity to participate in the clinical guideline development in a clinical research collaboration as an ECM work package lead. I had also the opportunity to speak in Congress as a speaker, take part in a career development program, take part in Congress highlights, and also as international conference presenter. So, what is an early career member? Early career members are clinicians, scientists, and allied health professionals with 10 years of completing their primary degree or under 40 years of age, a definition shared across major respiratory societies. So the scope is broad. The early career member can be a physician, researcher, or even allied health professional. Early career members can be the future leaders. So they're now early career members, but in the future they can be guideline authors, assembly chairs, or even society presidents. They are active participants in scientific societies. ECMs contribute to scientific assemblies, task forces, and governance bodies across multiple societies. How are ECM committees structured? They are the voice of the early career members. ECM committees formally channel early career interests across scientific assemblies and governance boards, ensuring junior voices shape society priorities. They organize ECM targeted education, career development events, networking opportunities, and scientific forums at congresses and online. They build partnerships with other societies' junior members' bodies to expand ECM opportunities through joint events and collaborative projects. The committee is the structural backbone of ECM engagement. It transforms individual enthusiasm into organized, sustained society involvement. ECMs are embedded at every level of the society, from governments to frontline scientific output. Why ECMs belong in guideline development? Respiratory societies increasingly recognize that ECMs bring irreplaceable value to the guideline process. So ECMs are often closer to the latest research, trained in an era of evidence-based medicine and systematic methodology. Many ECMs have formal training in systematic reviews, meta-analysis, and grade, which are core skills for guideline work. ECMs from varied backgrounds, countries, and subspecialties bring fresh perspectives and strengthen guideline applicability. And training ECMs now ensures the next generation of guideline authors, sustaining guideline quality over decades. Leading societies like ERS, ADS, BDS have codified ECM participation in guideline committees as a formal requirement, not an optional add-on. This reflects evidence that diverse teams produce more robust, less biased guidelines. ECMs often bridge the gap between patient perspectives and specialist opinion. Their training in shared decision-making and patient communication strengthens guideline implementation. ECMs frequently lead or co-lead the systematic review component, the most resource-intensive phase of guideline development, contributing skills in PICO formulation, literature screening, and grade evidence appraisal. Diversity in guideline panels, including career stage, is independently associated with higher guideline quality scores. So, some words for the guideline development process. We all know the PICO framework, P for population, meaning who is affected, intervention, what is being tested, comparator, compared to what, outcome, what matters to patients. The systematic review is the backbone of every guideline. ECMs who lead it shape the entire evidence base from which recommendations are drawn. Meta-analysis or narrative synthesis is performed in the evidence synthesis step 1, forest plots, heterogeneity assessment, and summary of finding tables prepared, which are all typically led by ECMs. Also, ECMs can be trained in grade methodology and contribute to profile completion. And also, ECMs can participate as full voting members in panel in the voting of the panel members. And of course, ECMs can contribute to the draft of guideline and also contribute to the revisions and the co-author final publication. ECMs who complete a full guideline cycle gain expertise equivalent to a formal postgraduate course in evidence-based medicine and clinical methodology. Other roles of the ECMs in task forces and working groups. The most common role of an ECM is a member of a task force as a full panel membership with voting rights on recommendation. They can be responsible for systematic review sections and data extraction. ECMs take primary responsibility for coordinating the literature search, screening, data extraction, and meta-analysis for one or more PICO questions. Senior ECMs may co-chair a task force or chair an ECM-specific working group representing ECM interests at the committee level. ECMs who contribute substantially may be listed as named co-authors on the final published guideline, which is a significant career milestone. Task force participation provides mentorship from senior experts, international networking, and a high-impact publication. Other fellowships and funding opportunities for ECMs. Here I have some examples of opportunities for early career members. We have ERS research fellowships, ERS short-term research fellowships, clinical research collaboration grants. Also, other societies have scientific programs for ECMs. Many fellowships require membership, so joining as an ECM is often free or heavily discounted, which may benefit a lot the ECM. Also, we have mentorship programs for early career members in many societies, including ERS, ATS, and BTS. For example, the ERS Next program, scheduled every year in the ERS annual congress, with many early career members involved and having very good opportunities in the context of this program. Also, informal mentorship can occur during a task force membership. Senior chairs guide ECMs through systemic review methodology, grade application, and academic writing. Also, during congresses, ECMs may be matched with senior researchers for informal lunches and which are highly valued for networking and informal career guidance. And also, ECM to ECM mentorship is highly appreciated within assemblies and committees. Peer networks provide practical support, shared experiences, and collaborative research opportunities. Congresses and ECM meetings can give many opportunities to ECMs. ECMs submit original research abstracts, and selected abstracts lead to oral presentations, poster session, or even best abstract awards, which is a key visibility milestone. Major congresses reserve sessions specifically for ECMs, skills workshop, career panels, ECM-only networking events, and ECM-led scientific sessions. Selected ECMs present Congress highlights to their national or regional communities, a prestigious role requiring strong communication skills and scientific breadth. ECM committee members attend official society meetings held during Congress, assembly meetings, board session, and cross-committee collaborations. So here we can see how the trends in ECM participation across respiratory societies have changed from 2015 until today. And you can see how the ECM participation has increased a lot during these years. Also, there are specific awards and recognitions for early career members, like the specific Best Abstract Awards, ERS Awards for early career members. Also, other societies have early career professional awards. So a tip would be to apply for every award you are eligible for. Competition is high, but the application process itself sharpens your research communication skills. Cross-society collaboration is important in the ECM committees and is highly done between ERS, ATS, BTS, also WHO. Cross-society collaboration multiplies the impact of every ECM contribution. What begins as a fellowship becomes a network that spans continents. Challenges facing early career members. Of course, there are time constraints. Clinical training, exams, and service commitments leave little protected time for research and society activities. Protected research time advocacy, flexible task force schedules, virtual participation options are some of the solutions. Funding gaps, travel, congress registration, and fellowship costs are prohibitive for many ECMs, especially from low middle income countries. Expanded travel grants, waived congress fees for ECMs, remote participation infrastructures are some of the solutions for this barrier. Visibility barriers. ECMs are often overlooked for speaking slots, committee positions, and guideline invitations due to lack of established reputation. Formal ECM quotas in committees, dedicated ECM presentation slots, ECM speaker nomination processes are some of the solutions. Geographic inequality, ECMs from non-English speaking or low-income countries face additional barriers to participate in international societies. Targeted fellowships for low and middle income countries, multilingual resources, regional ECM networks are some of the solutions for these barriers. How to get involved? Join a respiratory society. Attend your first congress. Submit an abstract. Apply for a travel grant. Join an assembly or working group. Apply to join your relevant scientific assembly as an ECM member. Apply for a fellowship or a grant. Join a task force or guideline panel. Every leader in respiratory medicine started exactly where you are now. The only difference is they took the first step. The future of ECM engagement. A remote task force participation, virtual congresses, and digital first committee work are removing geographic barriers for ECMs worldwide. AI tools for literature screening, evidence synthesis, and grade profiling are transforming the systematic review process. ECMs are leading this adoption. Targeted programs for low and middle income countries, ECMs, multilingual resources, and regional ECM networks are creating a more geographically diverse global community. ECMs are driving the adoption of open access publishing, preprint servers, and open data sharing, accelerating the translation of guidelines to practice. The future of respiratory medicine is being shaped now by you, by the early career members. And here I close with some key references that would be helpful for early career members focused on respiratory society and respiratory medicine. And I would like to thank you very much for your attention.